In this video, a patient with very high hyperopia undergoes vision correction with implantation of an IPCL lens. This is a plate-shaped, posterior chamber phakic lens. It is very similar to the Visian ICL, but features a wider range of possible refractive correction. It is made of a very soft hygrophilic acrylic material, and provides an aspheric optic with 6.6 mm of diameter. The technique is similar to any posterior chamber phakic IOL procedure, requiring only a somewhat distal side port, from which OVD will be injected to partially fill the anterior chamber. Then a main corneal incision of 3.2 mm diameter is made to ensure that the injector fits smoothly and without exerting pressure on the incision. The preparation of this lens is very straightforward, featuring a standard double rail cartridge that should be filled with OVD. Then the IPCL is placed over the rails and the haptics are tucked in. The only point of notice is that the two parallel superior holes should point to 12 o'clock once the lens is in the anterior chamber, so for a right eye this means that the hole should be in the lower rail of the cartridge. Then the cartridge is closed to an audible click sound, and a quick check is made with the soft tip of the injector, to see if the lens is freely moving. Now we advance to the implantation. With controlled taps in the injector, the lens is smoothly delivered to the anterior chamber and quickly unfolds. Small movements are employed to adjust the position of the lens and to begin tucking the haptics under the iris. This can be easily done with the tip of the OVD cannula. Once all haptics are tucked, BSS is injected to wash out the OVD through both incisions. The final steps consist of injecting Neocol, hydrating the corneal incisions, making sure there is no residual OVD, and finally inject antibiotic and the case is finalized. A marked improvement in vision was observed immediately next day. IOP was elevated but quickly normalized with topical IOP lowering medication. Don't forget that the hyperopic model does not have a central hole, so a peripheral iridotomy should be made prior to the surgery.